Hello, class. Today we're going to be talking about taking quality alginate impressions. This is a recorded lecture for those of you who weren't able to attend class today. This will give you the information that you needed to stay current with our class that's in session. So let's first talk about our learning objectives for today. By the end of today's lesson, you'll be able to discuss the anatomical structures affecting both the maxillary and mandibular impressions. Next, you'll be able to discuss and demonstrate proper tray selection when taking alginate impressions. You'll also be able to explain and demonstrate modifying an impression tray, explain and demonstrate proper mixing and loading of the tray, explain and demonstrate proper tray placement in the patient's mouth. You'll also be able to demonstrate proper tray removal from the patient's mouth, as well as evaluate the maxillary mandibular impressions. And lastly, be able to describe and demonstrate storage techniques. So as you can see, we're going to be learning a lot regarding alginate impressions. So let's go ahead and get started. Okay, so what are dental impressions? Impression materials are used to obtain an impression of the teeth, the surrounding structures of the oral tissues, or both. And impressions are a negative reproduction of the dental structures. So when we pour them up later on with plaster or stone, then that will be a positive reproduction of the dental structures. Alginate impressions are also known as preliminary impressions. So they're the start of something that we're going to create. And this is often taken by either the dentist or the expanded functions dental assistant. Most often it is taken by the expanded functions dental assistant. And we use these dental impressions for various reasons. First, we use them to create diagnostic models, which you'll notice here a picture of. We have the maxillary and mandibular diagnostic models with a wax bite in there. We can also use them for making custom trays, and we'll be doing this later on in our class as well. So here you can see after we create the alginate impression, we pour it up with a dense type of stone, and we can create custom trays for final impressions for prosthetics. We can also use alginate impressions for provisional coverage, otherwise known as temporary crowns or bridges, and we'll be learning how to make these a little bit later on in class as well. And lastly, we can also use them to make orthodontic appliances. So after they're poured up with plaster or gypsum, then we can go ahead and create or make orthodontic appliances. So very useful. So before we can go ahead and learn about taking alginate impressions, we also want to do a quick review on the anatomical structures. Now, you guys learned this information in term one, but we're going to go ahead and do a review on first the maxillary and then the mandibular. So let's talk about the maxillary hard structures that we want to see in our alginate impression. So first we want to see the teeth. We want to see the hard palate, and we want to see the tuberosities. And if you'll recall, the tuberosities is the anatomy or the anatomical structures directly behind the last molars. The soft structures, the labial frenum, and that is located right underneath the lip, above the central incisors, and the buccal vestibules, and that is that space between the teeth and the cheek, all the way around the arch of the mouth on the top. So now let's talk about the mandibular structures. So we have, again, hard structures and soft structures of the mouth. Obviously, the hard structures we want to notice in there would be the teeth and the retromolar area. That is the area directly behind the molars. And then behind that retromolar area, we should see part of the mylohyoid ridge. And that's the area spanning upwards to the very back of the mouth. The soft structures that we want to see would be the lingual frenum. We want to see a tongue space in our alginate impression on the mandibular. And we also want to see the buccal vestibules, and again, that's that space between the cheeks and the whole arch of the outer part of the teeth. And then the lingual vestibules, that's that space between the teeth and the tongue. So we want to capture all of that area there in order to really capture a good quality impression. So now let's talk about the material itself. Alginate is a material that can be purchased in a variety of ways. In our clinic, you'll notice it in like a size of a coffee can or a canister, but it can also come in pre-measured or individual packages. They are a little bit more expensive, but they do save time from eliminating that need to measure the powder. So you'll notice in the picture here in the background, you'll notice that coffee canister, and then a small packet in the front would be the pre-measured method, and the material can be supplied with flavoring. It can also come in color. So when it starts setting, you'll see that color change, and that's kind of a little bit of an alert to you of your setting time. And it is also important to know your materials as far as the expiration. For the shelf life of alginate, it is approximately 1 year. So we want to always take note of the materials we're working with and keep an eye on those expiration dates. So even though it comes to the office as new, it's manufactured at a certain time. So it's 1 year from the time of manufacture. So you always want to keep track of that. Now, alginate can come in various setting times, so it's available in two setting times. We have a normal set alginate and a fast set alginate. Here in our clinic, we use the normal set. As you guys are learning, this gives you a little bit more working time. The working time for a normal set alginate is approximately 2 minutes for working time, and then the setting time can be up to 4.5 minutes after mixing. Now, a fast set alginate will set up quicker, and your working time is reduced from 2 minutes down to 1 1/4. So it is definitely less, and it has a setting time of 1 to 2 minutes. After you're finished with this program and the clinical experience that you'll get used to working with a fast set. You'll be able to mix it faster, load it, and get it into the patient's mouth. So, what do we mean by working time versus setting time? So, working time is a time that allows you to mix the alginate, load the tray, and position it into the patient's mouth. And the setting time is the chemical action that takes place. So, definitely a good idea to know the type of material that you're working with, to know how much working time and setting time that you have. So, taking an alginate impression. So, these are all the criteria that it's important for an expanded functions dental assistant to be competent in. So the first thing you want to do is you want to gather all your necessary supplies, and this would be prior to seating your patient. So after you have all your supplies out, you want to go ahead and seat your patient. And then it's important to explain the procedure to the patient. I often like to ask them, have you had an impression taken before? And that gives you an idea of where they're at and how much you'll need to explain that to them. Selecting and modifying the impression tray, so we're going to talk about that. Mixing the alginate, loading each tray, seating each tray, keeping the patient comfortable while taking the impression, evaluating the impressions afterwards, and then storing the impressions if needed. Okay, so let's talk about gathering all materials. So to take an alginate impression, you want to have all those materials out and ready, which will include your rubber mixing bowl, your spatula, the alginate powder, the water measure, some people may call it a cylinder, and the scoop. Now the water measure and the scoop will come with the alginate, and so you will have that readily available inside that canister. You'll want to have out a maxillary impression tray and a mandibular impression tray. Oftentimes, I will lay out a medium if I know approximately if it's an adult or a child. If it's an adult, I'll lay out a medium-sized tray for both, and then I'll judge if I need to go smaller or larger. Tray adhesive may be necessary, utility wax, and then I always keep out a biohazard bag. We call that a precaution bag. And that's if I don't have time to immediately pour it up, that I can safely store it away where distortion won't occur. Okay, let's talk about explaining the procedure to the patient. So, what does your patient need to know? They need to know that the material is going to feel cool, that there's not going to be an unpleasant taste, and that the material will set up quickly. I usually tell them it'll set up in a couple minutes. You're going to also let them know that after the impression has been seated, they want to breathe deeply through their nose, and that will help them to feel more relaxed and more comfortable. For those that may have a gag reflex, this may also help them so they're not mouth breathing, they're breathing deep through their nose so it won't trigger that gag reflex. And then I also like to let my patient know that if for any reason that they're uncomfortable, to raise their hand. Impression tray selection. So impression trays are used to hold the impression material when the impressions are taken, and it must be rigid enough to carry the impression material directly into the oral cavity, hold the material close to the teeth, and avoid breaking during removal. We also want to make sure that it doesn't warp after the impression's been completed. So these are all characteristics that we want to look for when we're selecting the proper impression tray. Now, there are two different types of impression trays. One is a stock tray and the other is a custom tray. And I showed you a diagram earlier of a custom tray. For alginate impression, we typically want stock trays. So let's take a look at our different types of stock trays. So we have metal perforated, we have solid metal, we have plastic perforated, and plastic smooth. So you may be wondering, well, what's the difference between a perforated tray surface and a smooth tray surface? Well, a perforated tray surface allows that impression material to kind of ooze through those holes, and it creates a mechanical lock and it holds the material into place quite nicely. Now, a smooth tray, there is no mechanical lock, so in this case, you would need to put on a tray adhesive to hold that material securely in the tray. The best way to go is by choosing a perforated tray surface. We find that that is the best way of really ensuring that that impression stays in the tray. Now, depending on why you're making that impression is really important as well as far as your tray selection goes. So we have quadrant trays that covers approximately half the arch, a sectional tray, which is commonly the anterior portion of the arch. Now these two particular trays are great for making provisional. So if you're making a crown or a bridge, depending on where it's located, these two trays would be your best bet to take an impression. For the last one that you see here on the far right, that's a full arch tray. This would be great for making custom trays, orthodontic appliances, and again, those diagnostic models. So when we're selecting an impression tray, we want to make sure that number one, it's comfortable for the patient. It extends slightly beyond the facial surfaces of the teeth, so when you're trying it in, this is what you're looking for. You want to make sure that it's extending approximately 2 to 3 millimeters beyond the third molar or that retromolar area, tuberosity area back there. So you definitely, when you seat it into the mouth, you want to take your finger and you want to go all the way back there to ensure that we're getting the proper coverage. Then we also want to make sure that it's deep enough to allow about 2 to 3 millimeters of material between the tray and the incisal or occlusal edges of the teeth. So this is very important. So all these things when you're trying in the tray, you want to make sure that you have. So once you have that ready to go, then we're ready to go on to possibly modifying the tray. So let's say, for instance, that the tray fits well, but we're coming up just a little bit short in the back. Here you can use a material which we have illustrated here in this photograph, what we call rope wax. So you can take this and you can extend the length of the tray by using this rope wax or utility wax along the back border of the tray. But you can also extend the height of the tray by extending it or adding it all around the border of the tray. So if you're coming up just a little bit short, you can add that around the entire border of the tray. I also find that this also is very helpful for adding a little bit of cushion if the patient's terribly uncomfortable with the tray. So we can really use it for both reasons. And for a patient with an unusually high palate, you can also use softened utility wax and add it to that palatal area of the impression tray. And that'll raise it up so that you can ensure that you're getting the full palate. Okay, next let's talk about measuring the alginate because this is a critical component as well for taking quality impressions. So it's important to accurately measure the alginate material. So now let's talk about measuring the alginate because this is equally as important as far as achieving that quality impression. So we want to make sure we have our powder and we have our water to be mixed out first. First, when you're going to get your powder measurement, you want to take the canister and first fluff it. And that means taking it upside down, and that'll take it from a more compact state and fluff it up so that you're getting more accurate measurements. So generally for adult mandibular impressions, you could do 2 scoops of powder to 2 measures of water. For adult maxillary impressions, generally that requires about 3 scoops of powder to 3 measures of water. And most importantly, you want to make sure you're placing the water into the mixing bowl first and then adding the powder. So you want to have that ready to go so that before you start, you have everything measured out. Now you can alter the setting times of alginate. So if you're working with a material that you know may be a fast set and you need just a little bit more time, you can use cooler water to increase the setting time if additional setting time is needed. Or you can use warmer water and that will reduce the time of the procedure. So in cases where you're working with a fast set material and you need a little extra time because maybe your patient's a little bit more difficult, you can go ahead and use cooler water to slow that down. Now, if you have a normal set alginate material that's only available and you want a quicker set, go ahead and add some warmer water. So now there are 2 different types of mixing techniques. The first technique we use here in the clinic, and it is the most common mixing technique, and that's where you're going to be using manual spatulation, which requires the rubber bowl along with your beaver tail wide spatula, and there you will be spreading it against the sides of the bowl to not only mix the water and the powder, but to also make it more creamy and to reduce any air bubbles that are in it. Now, another technique that is used, and most more of an automated technique, and that is using an alginator. And this uses the same type of bowl. It's attached to an electrical component that has low or high speeds to it. So there the bowl will automatically spin in a clockwise direction. So all you'll have to do is use your spatula to spread it against the sides of the bowl. So now let's talk about loading the tray. So when you're loading the tray, you'll notice in these diagrams here on the very top, we have the mandibular impression tray, and on the bottom we have the maxillary. Generally for both, you're going to gather half of the alginate onto your spatula, and then you're going to wipe the alginate onto one side of the tray. And you're going to press that material down into the base of the tray, and this will help remove any air bubbles. Then you're going to gather the other half and load it onto the other side of the tray in the same way. After that, then you're going to turn on the water and you're going to smooth the surface of the alginate by wiping it with a moistened finger along the surface. So you're just going to smooth it out and then you'll be ready to take the alginate impression. The first impression that you want to take will be the mandibular. And the reason that we take the mandibular impression first is that it's easier for the patient. So we always want to start on the bottom first. You want to raise the dental chair for the mandibular, and that will help you to reduce any strain on your back from leaning down. You want to stand in front of the patient, and then you want to place alginate over the occlusal surfaces of the teeth first before seating that tray. Next, you want to retract the patient's cheek with your index finger, and then you want to turn the tray slightly sideways to place it into the patient's mouth. Center the tray over the teeth, and then press down on the posterior area of the tray first, and then slowly work that down and press it down towards the anterior portion. Then you want to instruct the patient to place their tongue up, and that'll help right up in between the 2 sides so that their tongue doesn't get stuck on the impression tray. And then lastly, instruct the patient to breathe through their nose. Now let's talk about the maxillary tray. So the maxillary tray is definitely more difficult for the patient. So we want to first lower the dental chair, and that will help give you access to reaching over the patient as you notice here in the diagram. You want to stand behind the patient. You want to place the alginate again over the occlusal surfaces of the teeth first before seating the tray. Retract the patient's cheek back with your index finger first, and then turn the tray slightly sideways to place it into the patient's mouth. Again, center the tray over the teeth, and then press down in the posterior area first with the tray, and then you want to work your way towards the front in that anterior portion and press down as well. Instruct the patient to breathe through their nose. This is really critical on the maxillary. If a gag reflex is triggered, you want to instruct the patient to lean their head forward. Let's talk about tray removal. So to avoid any injury to the impression and to the patient's teeth, we want to use caution. So for the mandibular, place a finger along the lateral borders of the tray and push up to break the seal of the peripheral tissues. And you want to be careful when you're removing the impression tray that you don't hit the top teeth. So I usually rest my fingers right on top of that tray to avoid hitting the occlusal surfaces of the maxillary. Now on the maxillary, to remove the tray, you want to place a finger along the lateral borders of the tray and gently push down to break that palatal seal. Now that'll be a little bit stronger than on the mandibular. And again, I keep my fingers right over the bottom part of that tray and I carefully remove it so that it doesn't snap back and hit the occlusal surfaces of the mandibular teeth. So after we're finished taking both the maxillary and the mandibular impressions, we want to evaluate the impressions. So we want to look for, when we're looking in the impressions, are the impressions centered with the tray? So that's important. I usually use the handle of my impression trays as a guide. So if I see the central incisors lined up in the center of that tray handle, then I'll know if it's been centered or not. You'll notice the mandibular impression on the PowerPoint slide here looks great. When you look at the maxillary, it looks like it's slightly off a little bit to the right. It's still acceptable, but it's not completely centered. You'll also want to look for a complete peripheral roll. That's including all those vestibule areas. So if you look at the mandibular and maxillary impressions here, you'll notice that we have a beautiful roll on the mandibular and we have a roll as well on the maxillary, and that extends all the way around the trays in those vestibule areas. And we want also, when we're evaluating, we want to make sure that the tray is not overseated. What you'll notice when you have an overseated tray is you'll actually see the tray itself kind of peeking through the teeth. And in this case, it's all one uniform pink color. So if they were, we would actually see some metal peeking through on those occlusal surfaces, and we don't see that in this case. We also want to make sure that the impression is free from any tears or voids. Now, sometimes this will happen upon removal. So if that happens, we definitely need to retake it. So we also want to look for the anatomic detail of the teeth and the surrounding structure. So this is critical. Again, if we're fabricating or we're making something, we need to see that detail. So there you want to carefully evaluate that we don't have any distortion that takes place upon removal. Sometimes you'll notice if it moved in the mouth during the impression process, you won't see that sharp detail. So we definitely need to see that. And if you don't, you'll need to retake your impression. You'll also want to look for the surrounding structures. Again, that's why we did that review in the very beginning. We want to notice the retromolar area in our impression. We want to notice the lingual frenum, the tongue space in this mandibular impression. We want to see part of that mylohyoid ridge. Now, when it comes to the maxillary, we definitely need to see all of the palatal area. So we want to see that whole palate and the tuberosity. So all of that needs to be recorded in these alginate impressions. Very important. Most alginate materials need to be poured up within 1 hour of taking the impression to avoid any distortion. So if for any reason, as an assistant, I know things get busy, if for any reason that you don't have the time to pour them up immediately, you definitely want to wrap them up in a damp cloth and you want to store those away in a plastic bag to prevent any distortion from occurring. I'll be happy to take any questions if you guys want to email me, or you can also write them down and we can discuss it tomorrow in class. Tomorrow, I'll be demonstrating this skill for you, and then you guys will go into a practice, and then later on, we'll be doing a hands on performance.